Hello and Assalamualaikum. Welcome back to my YouTube channel. My name is Nokratu Najah binti Abdul Ghani from ELC 590 Group 6. For this video, I want to talk about idea pitching. I have chosen to share about an innovation product that is most necessary for every family in Malaysia and also around the world. Everyone must be asking what product I will share. I want to share this product, which is pulse oximeter. Before we talk more about this product, I want to talk a little introduction about this product. First of all, the first pulse oximetry was developed in 1972 by Japanese bioengineer at Japanese medical electronic equipment manufacturer in Japan. Using the ratio of red to infrared light absorption of pulsating components at the measuring site, pulse oximeters have limitations and risks of inaccuracy under certain circumstances. In many cases, the level of inaccuracy may be small and not clinically meaningful. However, there is a risk that an incorrect measurement may result in unrecognized low oxygen saturation levels. Therefore, it is important to understand the limitations of pulse oximetry and how accuracy is calculated and interpreted before we using this device. Next, we move to problem issue. If we did not face this age of COVID-19, we will not be aware of the existence of this pulse oximeter. This is because this pulse oximeter is rarely used by the public because they do not know the advantages and benefits of having this device. Before this pulse oximeter was widely used by many people need to go to the hospital to get oxygen reading if they had shortness of breath or had an abnormal heartbeat. The coronavirus disease 2019, which is COVID-19 pandemic, has caused an increase in the use of pulse oximeter. Patients with conditions such as COVID-19 who monitor their condition at home should pay attention to all signs and symptoms of their condition and communicate any concern to their healthcare provider. Be aware that multiple factors can affect the accuracy of pulse oximeter reading, such as poor circulation, skin pigmentation, skin thickness, and skin temperature. Review the information in the sections below to better understand how accuracy is calculated and interpreted. Refer to the device labeling or the manufacturer's website to understand the accuracy of particular brand of pulse oximeter and sensor. Different brands of pulse oximeter and even different sensor, which is finger clip versus adhesive, may have a different accuracy level. Pulse oximeter are least accurate when oxygen saturation are less than 80%. Consider accuracy limitation when using the pulse oximeter to assist in diagnosis and treatment decisions. Use pulse oximeter reading as an estimate of blood oxygen saturation. For example, a pulse oximeter saturation of 90% may represent an arterial blood saturation of 86 to 94%. When possible, make diagnosis and treatment decision based on trend in pulse oximeter reading over time rather than absolute thresholds. Next, a pulse oximeter is a device that is usually placed on a fingertip. It uses light beam to estimate the oxygen saturation of the blood and the pulse rate. Oxygen saturation gives information about the amount of oxygen carried in the blood. The pulse oximeter can estimate the amount of oxygen in the blood without having to draw a blood sample. Pulse oximetry is a non-invasive method for monitoring a person's oxygen saturation. The new coronavirus that caused COVID-19 enters the body through the respiratory system, causing direct injury to a person's lung via inflammation and pneumonia, both of which can negatively impact how well oxygen is transferred into the bloodstream. This oxygen impairment can occur at multiple stages of COVID-19 and not simply for critically ill patients placed on ventilators. So we do not have to bother going to the hospital for a checkup if we feel unwell. Furthermore, we should also take our oxygen reading, especially since we have experienced COVID-19 wave. We also know the symptoms of COVID-19. Therefore, every home needs this oximetry pulse to see our daily oxygen reading so that we are always vigilant with the health of our body. In fact, there are phenomena we observe clinically where a person with COVID-19 can have very low oxygen level but otherwise appear well. Term happy hypoxia. Term happy hypoxia is concerning because this patient may be more significantly ill than they feel, certainly warranting closer attention in a medical setting. It is why you may be wondering if an oximeter can help detect COVID-19 early. However, not everyone who tests positive for COVID-19 will develop low oxygen levels. There are people who may have a very uncomfortable with fever, muscle ache, GI upset at home, but never demonstrate low oxygen levels. Ultimately, people should not think of a pulse oximeter as a screening test for COVID-19. Having normal oxygen level does not mean that you are free of infection. If you are concerned regarding exposure, formal testing is still required. Therefore, this device can help for early action for the diagnosis of COVID-19 symptoms. If we find that the symptoms are getting worse, we will get early treatment in the hospital, and we can prevent the disease from continuing to get worse. In addition, someone who does not have COVID-19 symptoms also needs to have this device at home. This is because we can take our oxygen reading at home and not have to bother to go to the hospital because this device is easy to carry anywhere. It is also have a small size, and this device also use battery, so it can be take everywhere. So it's easy to use and also easy to carry. This poster shows the step how to use pulse oximeter. For the conclusion of this video, if a person have a mild case of COVID-19 and is self-treating at home, an oximeter can be a helpful tool for checking oxygen levels so that low oxygen level can be caught early. In general, the people who are theoretically more at risk for oxygen issue are those with pre-existing lung disease, heart disease. If you have this positive for COVID-19 and are concerned about any developing symptoms, check immediately with your healthcare provider. Lastly, whatever you have an illness or not, this device should be at your home so that it may help use during emergencies. In the event that you are a loved one become ill, this device may be used as a tool for early prevention. However, this is just a tool to determine the oxygen content in the body, and the reading can also be inaccurate at certain times. So that's all from me. Thank you for watching and see you next time. Bye.